Cloudcast Media.
Drew Schlosberg Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
I'm Drew Schlosberg with Cloudcast Media, and we are absolutely thrilled, as always, when sitting across from me in the studio is my longtime good friend, Deacon Jim Vargas, the president and CEO of Father Joe's Villages. How you doing, Deacon Jim?
Good morning, Drew. It's always a pleasure to be with you. Thanks for having me.
First and foremost, how's the family?
Oh, they're well. They're well. Yeah, we're blessed, and especially during this time of year. What about yours?
Good. Sammy is finishing up her last day before a winter break. She's teaching 4-5 combo at Chaparral Elementary School.
You had mentioned that. Is she enjoying it?
She much more this year. It was a little tough last year with the pandemic. You guys know all about that as well. Right. So she's doing a great job, loves the kids, and can't wait to spend some time with her nieces in Colorado Springs. So she's doing well. I mentioned
wonderful.
The fact
That's
that
great.
he said that. And joining you is Dr. Jeffrey Norris. He's the Chief Medical Officer for Father Joe's Villages. How you doing, Dr. Norris?
I'm doing well, thank you.
Very, very. And your family? Well, we're talking about families. They're doing well?
Oh, they're doing very well.
Good.
Absolutely.
How long have you been involved with Father Joe's Villages?
I've been there 7 years now.
Okay. So do you have a staff that works with you?
Yeah, we do. We have what's called a federally qualified health center, which is a federally funded and authorized clinic that provides services for folks who are underserved within the community. And specifically, we target people experiencing homelessness. So we're a department of the larger agency, Father Joe's Villages.
Right. And now, do they come to you, the ones that get your services, or do you go out to them? Do you have like a medical mobile unit? Because we all know that the homeless is not just in downtown San Diego. It's throughout our region. How does that work?
Yeah, so we do have a brick and mortar clinic, but as you're alluding to, not everyone comes in for services in our brick and mortar clinic for a variety of reasons. And so we believe firmly in going to the people, as we say, and taking services to them to make it easier for folks to access healthcare services.
Right. Deacon Jim, we always do this each year, every episode for that matter. What's the main mission of Father Joe's Villages?
Well, simply put, but it's not that simple, right?
Correct.
It's to prevent or end homelessness one life at a time.
Right.
Right. And we do that in various ways. And the health clinic, the health center is very much a part of our comprehensive services. In addition to that, of course, we have shelter beds. In fact, we have the most shelter beds in the county of San Diego, about 1,200. And it's still not enough. And then along with the shelter beds are the million meals that we serve, breakfast, lunch, and dinner in our 2 dining rooms. And the ancillary services that go along with that, but including the therapeutic childcare center, which is for our kids. Kids who come to us who have been homeless in homeless situations are 4 times to be homeless in adulthood unless we mitigate their circumstances. So it's extremely important that we focus on them. The wonderful thing about kids is that they're very resilient, right? So if you apply the right resources and love, they bounce back. And then employment. Employment is very important, so we have our vocational training sessions. It imparts marketable skills, and with those skills comes employment and then income and then self-sufficiency. So that's an aspect. And we build affordable housing. At the end of the day, we love bringing people off the streets and immediately starting to work with them and into shelters, and yet a shelter is not a home, as I've always said, right? So the affordable housing that we construct, the largest of its kind, was just opened this past February, you recall. St. Teresa of Calcutta Villas has 407 homes, has taken over 500 people off the streets. And so, and that's important. But again, it's the comprehensive services that go along with all that make a difference and keep people off the streets. And that's where Dr. Norris and his team come in on the health side.
Yeah, we're chatting with Jim Vargas, Deacon Jim Vargas. He's president and CEO of Father Joe's Villages, joined by his colleague, Dr. Jeffrey Norris, chief medical officer for Father Joe's. I'm Drew Schlosberg of Cloudcast Media. So, Dr. Norris, much has been written about. I think the last numbers were homelessness was up, if I'm not mistaken, at least as reported in the San Diego Union Tribune and so forth. Tell me what that does. What impact does that have for what you folks and your team does?
It just means the need for healthcare services and social services at large is increasing as more and more folks end up on the streets, and folks are on the streets for longer and longer periods of time. That means worse health, whether that's physical health, behavioral health, that includes mental health and substance use disorders. Folks get worse. They're not as well. It's very difficult, if not impossible, to be healthy and well on the streets. And so the need for healthcare is certainly growing over time.
You brought up something that has been talked about a lot, whether you're homeless or not. Mental health is probably at crisis stages here in this world, for that matter, not just our country, but much has been written about that, especially with the youth and so forth, but especially in the population you folks serve. That's got to be a huge part of your job.
It is, yeah. Folks sometimes end up on the streets in part because of mental health issues.
That's right.
That's not necessarily the primary driver, but that's something that kind of pushes them over the edge. But even for folks who don't have mental health issues, when they end up on the streets, many folks develop mental health disorders because of the stress and the trauma of being on the streets. It is not an easy life on the streets, and that life starts to eat at your mental and physical health, and people get sicker and sicker on the streets.
Right. So tell me how the street health program works.
So street health is our version of what's called in the rest of the world street medicine. It's about taking healthcare services to folks on the streets. And when I say healthcare services, I mean actual healthcare services. We have prescribing clinicians going out into the streets, into the park, into encampments, and seeing people where they live. It's like a home visit for somebody experiencing homelessness. And it's really about building relationships, gaining trust of folks on the streets, and starting to work on their health issues so that we can provide an opportunity to head a different direction.
Right. So if somebody refuses your services, okay, and they may be a little combative or whatever the case may be, I don't mean going crazy and trying to put somebody in physical harm, what are your next steps? Do you work with community service officers? Do you go back to Deacon Jim and say, boy, we're having a tough time with Sue, or whatever the case? How does that work?
So if it's not, obviously if it's somebody who's immediately putting our team at physical risk, well, that's a different situation. But if we're talking about somebody who just is clearly struggling and is not open to engaging at that time, the most important thing from our perspective is to keep showing up for that person. Often it will take 3, 4, 5 interactions, regular, consistent interactions, to show that individual, hey, we care about you. We are here for you. We want to support you. We have your interests at heart. And sometimes it takes that many encounters, that many points of contact before folks start to open up. There's a lot of distrust among folks living on the streets, distrust of authority, distrust of the quote-unquote system. Folks are not always willing to engage, and sometimes for very good reasons.
Right. And do you find some of these folks, are they always in the same spot? I should know this now. I've interviewed Deacon Jim 4 million times. But, so are there certain people they've staked out where they're going to be, whether it's the old library or whether it's the new library or wherever the case may be? And is that where you find them? Oh, look, old Josh is going to be over here. We know we can help him. Or we're not sure where Josh is going to be.
So it's a mix of both. Some folks have a very clear staked out area and they tend to be there for long periods of time. But then folks are also very mobile. They're moving around, sometimes because of necessity to stay safe, to find food, et cetera. But then there's also forces at play in the larger community related to public safety, the police force, et cetera, that move folks around. And so we do have trouble sometimes following up with folks and finding them. So that's actually one of the biggest things when we're engaging with folks that we talk with them about. Number one, we record in our street health program what street corners, for instance, they usually are at. But then we also try to get a sense of what their community is and who they interact with, so that if we are searching for them and they're not in their usual spot, we can ask around to their family, quote unquote, their community, and say, have you seen Josh? Do you know where Josh is? And we know who to kind of reach out to. So we tap in to the literal social network of these individuals to find them.
Right. Deacon Jim, how many of the folks that, Dr. Norris and his team will, chat with, will offer services, eventually make it to one of your shelters?
It depends, actually. And the reality is that it's extremely difficult to work with this population, especially those who are on the streets and don't necessarily want help initially. It doesn't mean that they want to be on the streets, but they're distrusting, as Dr. Norris mentioned, and you have to build relationships. So over time, it takes a number of contacts. There was Megan on Dr. Norris's team, one of the senior members, mentioned to me the other day that there was someone who they finally were able to help, who shared with them that initially they thought that Dr. Norris's team was weird. All right. And they didn't want any part of that team. And then she came to know them. Why? Because they were persistent.
Sure.
And so as a result, she finally realized, hey, they really did want to help. And now she's doing tremendously well. It's great. She has her own little place.
Nice.
And they've addressed her health needs and so many other aspects. And that's just one of many. Right. And so it's hard to pinpoint an actual number there. But the point is that we have to keep at it constantly. And there's a lot of success. I don't know if you have any numbers in that regard, Dr. Norris, but there is a lot of success there. The tenacity is what's absolutely important.
When we come back from break, we're going to chat more about that aspect of it. I'll dig deep into Dr. Norris. What can our listeners do? If you had a magic wand, obviously money doesn't grow on trees. Money is really important for 75 different reasons in what your folks doing. But would that help? More resources, more doctors, more health professionals working with that street health team. And then Deacon Jim, we always like to go back. You've always got a cool story to tell. I see you've got one written down here, and I want to share that as well. And listen, we just want people to get engaged in all the great work you're doing. When we return with our good friends from Father Joe's Villages, we got the CEO, Deacon Jim Vargas, and the Chief Medical Officer, Dr. Jeffrey Norris. I'm Drew Schlosberg, and you've been listening to another episode of Drew Schlosberg Spotlight on the Community show, brought to you by Cloudcast Media and Mission Fed Credit Union. The credit union is doing great things for San Diego for more than 60 years. We will be right back.
When you do your banking with Mission Fed, you get great rates on auto and home loans. That's good for you, but something good also happens for a lot of other people. We're not for profit, so we put money back into the community to help lots of great nonprofits to keep San Diego strong. So you're not just getting something good, you're doing something good. Come to Mission Fed. It's banking that's good for all.
Brand amplification is the DNA of Cloudcast Media, and our code is the powerful blending of sound, voice, and storytelling to lift local brands and their communities. Whether it is our Brandcast, Schoolcast, or Causecast platforms, the unifying ethos is all about this community, the one you call home. If you dare to dream and want to explore the brand amplification of Cloudcast, a national leader in local podcasting and other Winfluence strategies, please visit us at cloudcast.us.
I'm Drew Schlosberg, and you've been listening to Drew Schlosberg Spotlight on the Community show on Cloudcast Media, brought to you by Mission Fed Credit Union, bringing great things to San Diegans for more than 60 years. talking to our good friends from Father Joe's Villages, Deacon Jim Vargas. He is the CEO, joined by his colleague, Dr. Jeffrey Norris, Chief Medical Officer. And we were talking about this magic wand that is in the hands of Dr. Norris right now. And you've got some ideas of what you want to use that wand for, correct? That might surprise some people.
I think it will. The reality is, if I had a magic wand, I wouldn't wave it to do anything with healthcare. The first thing I would do would actually ensure that housing was affordable across our entire community for every single individual. The reality is, for the work I do, there's only so much we can do to improve people's health and wellness when folks are actively on the streets. The stress and the trauma of being on the streets means there's only so far you can get. So we have to resolve homelessness as a larger social issue if health and wellness are going to get better. And another way to look at it is the work that I do, that we are doing within our health center, is really work that's kind of at the end of a disease process, if you will. So if we think of homelessness as a disease process, we're talking about very advanced disease. We're talking about kind of the end of the line where folks are really not doing well. And we want to work on prevention. We want to prevent folks from ending up on the streets to begin with. And resolving that crisis, folks ending up on the streets, we've got to resolve housing affordability issues.
Yeah, there's no question. Deacon Jim?
Yeah, that's a great point. In fact, we've been saying for years, actually, at Father Joe's Villages, that homelessness is an economic issue. People are falling into homelessness because of the economy here in the county of San Diego. People think right away they gravitate to drug use, or to mental health challenges, and a host of other things. And they exacerbate situations, to Dr. Norris's point. But the number one reason people are falling into homelessness is an economic one. It is extremely expensive to live here. And now, why are we seeing the numbers increase, Drew? That's because, it was the COVID-19 didn't help, the pandemic didn't help, and now the rising inflation. When you have to pay more for eggs and for gasoline and for milk and so forth, just the staples, people are just hanging on, are falling onto the streets. So it's the economics.
Yeah, it's funny because people who don't understand that that $10 makes a big difference on whether you're going to eat today or whether you're going to be, some shelter or some clothing or whatever the case may be. And it is that tight. And we all know, Deacon Jim, you and I have talked about this quite a while, these economic situations, whether it's, the 2008 meltdown on real estate, or it's a pandemic, or it's inflation right now, that a lot of people, this is not the cheapest place to live, San Diego, that's an understatement of the world. They are a paycheck away from being in that car and so forth. So you're spot on that. Yeah, let me get a question back to Dr. Norris on this. Do you treat people, so to speak, or offer services to those who are living in their cars?
Absolutely. Yeah, we definitely do. Within the health center, if we encountered somebody on the streets,
right,
and they needed healthcare services, they could receive services through our street health program or come to our brick and mortar clinic to get services. Absolutely. As long as folks are experiencing homelessness or at risk of homelessness, our health center is serving them regardless.
Right. And, talk a little bit about, and you jump on this too, Deacon Jim, but Dr. Norris, do you work with other health entities? Do you work with the hospitals? Are you working with the mental health systems and everybody in between?
Yeah, we have a lot of partnerships with a variety of folks. We work with a number of local area hospitals to coordinate care. We work with other federally qualified health centers within San Diego, and at a very deep level in some cases to do better for all of our patients, whether it's folks experiencing homelessness or not. And then we're tapped into a lot of work that's being done at a state level and federal level.
Right. And we all know, Deacon Jim, that's your bread and butter. I've known you for quite a while. You've always been a guy that loves to collaborate. 1 + 1 does equal 8. In fact, if you don't collaborate, and now in the 21st century, you're just doomed for, to die a slow death, so to speak.
That's extremely correct. In fact, I was just meeting with the mayor in his office, the mayor of the city of San Diego,
sure,
just the other day, and we were just talking and going back and forth on discussing the issue of homelessness in general, and then possible solutions. Heaven knows how we have Father Joe's Villages. We have a lot of suggestions,
right,
and we advocate for a lot, and he's one that listens and he respects the work that we do, and then of course listening to him and what he sees as approaches,
sure,
that and at the county level as well, Supervisor Nathan Fletcher. So all these collaborations are extremely important because we can't do it alone. We, as much as Father Joe's Villages does and has done for many, many years, at the end of the day, we can't do it alone. You know, we made a commitment to introduce 2,000 affordable housing units, as I mentioned, the most recent. And we're getting to it, and we're doing more and more in that regard. But that's not enough, right?
Right.
And so we need other collaborators in there to be able to really make a significance as a whole. I've always said that as we take people off the streets, as we help them to self-sufficiency, the community as a whole becomes healthier. And that's what it's all about.
Well, it does talk about this story. You always have one great story, a great example of how you guys work together and neighbors pull together about Sam and his family.
Oh, Sam. Well, Sam is someone who had been, and we find this very typical in that he fell into economic time. Talk about somebody who was hit economically, right? Wound up losing a job. Right, his health started deteriorating. Initially living on the streets, and then lost the car. I started living in his cars, I should say.
Yeah. And
then lost the car, and then wound up living on the streets, right? And all the difficulties that he had. And so it was a matter that initially there was resistance on his part. But then he was someone who, when he came into the village as a whole, and then started accessing the health center and in the resources that we had for him at the health center, then started getting on track, right? And there was the initial resistance on his part, and we find that a lot, right?
Sure.
But then when we finally made that breakthrough, and how things started falling into place, we were able to help him find employment, and then an apartment as well. Right, so he's one of the many success stories that we have.
Well, he's gainfully employed now. He's working he's got some stable employment. He got his security guard training. And that was through one of our vocational training programs. Well, you think about it, we've chatted about this many, many times. I think Dr. Norris would agree. Yes, you are certainly treating, in Dr. Norris's case, that individual. But when that individual, is helped and is now doing what Sam did, it's not just Sam, it's Sam's family, it's Sam's relatives, it's Sam's aunts, uncles, you pick a topic.
You're right, because by extension, I mean, these people, a lot of them become estranged from their families because of their circumstances. So then when you have that unification or reunification as a result of the person becoming healthier, and they're able to rekindle relationships even with children with whom they become estranged, right? So these are the many miracles that we experience, and they don't come easy.
No.
A lot of them come through a lot of pain and a lot of challenges. But the thing is to stick with it, as Dr. Norris and his team does constantly, not give up, and that makes all the difference in the world, because people then come to realize, these guys actually do really care.
Well, listen, it's not just the resilience on the folks that are on the streets or working for you folks. It's also the staff, like Dr. Norris's staff as well. We got about a minute or so to go. We'll start with you on this, Dr. Norris. Any final comments?
I think the most important thing to take into account is what Deacon Jim is reinforcing. Homelessness ultimately is a macroeconomic issue. Mental health issues, substance use, et cetera, certainly can exacerbate homelessness at an individual level. And we can't ignore mental health and behavioral health issues. We must address them to help individual folks, person by person, and we need to improve those systems of care. There's no doubt about that. But we also have to work on the macroeconomic issues, the affordability of housing. It's not an either or. We sometimes talk about it as if it's one or the other. It is not. We need to do both. We have to do both those things if we're going to crack this nut.
Yeah, without question. Deacon Jim, any final comments?
Sure. I always invite your listeners, and they're great to us to help us in our work. And in various ways, we can only do the work because of the generosity of your listeners. So the various ways of doing that, of course, go on to neighbor.org. Neighbor.org, that's our website. You get a whole host of information that you can garner there. And then there's obviously opportunities there that you can volunteer many ways to volunteer at our village, and we love our volunteers. They help us do our work. And then, of course, donations, whether they're cash or stock donations. At this time of year, people are thinking about their year-end donations, so stock and cash donations. You can come and shop at our thrift stores. We have 4 thrift stores in the city of San Diego. Great quality merchandise at wonderful prices, and all the proceeds go to the services and the programs. And you can even donate to those stores and our auction houses. We have trucks that go out on preset appointments each and every single day. People who are downsizing and they don't need certain furniture, we're willing and very willing to go and pick it up from them, and then again turn it around to cash and services. So a host of ways to help Father Joe's Village.
Well, I'm one of the ones that took that services.
You did.
And I'm about to do it again, and we'll chat about that offline. Dr. Norris, what a pleasure meeting you, and wishing you nothing but great success, you and your staff, on what you're doing. Just amazing work in that area. I appreciate you coming in. And Deacon Jim just smiles, abound when you're in the studio. And just want to remind the listeners, yes, this is giving season, but homelessness doesn't know a date. March 25th, July 7th, August 24th, just as important as from Thanksgiving to the end of the year. Deacon Jim and Dr. Norris, wishing both of you nothing but a great holiday season filled with happiness, good health, and prosperity, and I'll look forward to having you back on after the first of the year.
The same to you. God bless you, Drew.
Thank you. Thanks for having us.
You bet. I'm Drew Schlosberg, and you've been listening to Drew Schlosberg Spotlight on the Community Show on Cloudcast Media, brought to you by Mission Fed Credit Union, bringing great things to San Diego for more than 60 years.
You've been listening to an episode of Drew Schlosberg's Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego community. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
Cloudcast Media.